Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Torsade pointers we are looking at is etiology or the causes. So the first one is the acquired prolongation of the QT. So acquired prolongation of the QT interval. So under this we have the electrolyte abnormalities. So electrolyte abnormalities, it includes the presence of the hypokalemia. So electrolyte abnormalities can include the hypokalemia and it includes the hypomagnesemia. It's hypokalemia, hypomagnesemia as well as hypocalcemia. So 3 hypos. And next we move on to the drugs. So in terms of the drugs, it includes the antiarrhythmic drugs. So antiarrhythmic. So antiarrhythmic drugs, it includes a class 1A, 3. So what does class 1A? 1A, it includes the quinidine. So class 1 includes quinidine as well as a disopyramide. So quinidine, disopyramide and procainamide. So these are the class 1. Now let's look at the class 2. Class 3. So here in class 3, it includes the sotalol, next amiodarone, and amiodarone is nothing but there is a QT prolongation. So there is QT prolongation and it is common, but the Torsade ventricular tachycardia is rare. So there is QT prolongation common. But the Torsade ventricular tachycardia, this is rare. So the other drugs which are included in the class 3 are the ebutilide, the dofetilide as well as the almocalate. Now let's look at the antibiotics. Antibiotics, there is a macrolides. So under macrolides there is erythromycin. So erythromycin, then comes a clarithromycin. So erythromycin, clarithromycin, azithromycin. Next we look at the fluoroquinolones. Fluoroquinolones, there is levofloxacin, there is moxifloxacin as well as the gatifloxacin. Then other antibiotics, it includes the trimethoprim, there is trimethoprim, sulfamethoxazole, sulfamethoxazole. Next is the clindamycin, the pentamide, the pentamidine, chloroquine, antifungals such as the ketoconazole, itraconazole. So ketoconazole as well as the itraconazole. Next also the antivirals, antipsychotics as well as the antihistamine. To learn and grow daily like this, please do subscribe.